I'm going to discuss some advanced imaging applications analysis of liver disease using quantitative MRI and a little bit, there's also a lot of work on CT. I'm going to mostly discuss MRI. And there'll be two parts to the talk. First, I'm going to discuss radiomics analysis, and then some discussion about machine learning and deep learning. And you'll see at the end that there will be probably a combination of both. So before I get into the radiomics discussion, I want to discuss something important in tumor biology, which is intratumor heterogeneity. It is something that is very important because tumors that are more heterogeneous in terms of phenotype or even genotype can be difficult to treat. They get really more resistance to systemic therapy or chemotherapy or radiation therapy because they get different phenotypic areas that can have different blood flow, for example, or different expression of certain molecular profiles, etc. And that heterogeneity can be observed in a single tumor. It can be also observed in different tumors in the same patient or between patients. You're talking about, for example, lung cancer. There will be some major expression heterogeneity of certain markers, for instance, like KRAS or mutations and things like this. The issue with heterogeneity, also the sampling error is the issue. When you want to sample a tumor, typically in oncology, you really want to have tissue, right, before you start treatment, except for liver cancer we discussed yesterday. And the issue of heterogeneity is that if you hit an area with certain phenotype, you may not represent the whole tumor. And what's interesting also is that metastatic lesions can also acquire different phenotypes compared to the main tumor, and they can evolve independently from the primary tumor. And the interesting thing about imaging, we can really assess the whole tumor and assess heterogeneity at a whole level, and you can repeat it, non-invasively. So this is an example of a magnified, liver cancer tumor. It's right there in the back of the liver, and you can see significant heterogeneity, expression of different, markers of flow, diffusion, and T1 mapping, for example. So you can see, for example, that the arterial flow is going to be higher for some reason anteriorly, and the back of the lesion is more hypoxic and less flow. And this is something you can really not only visualize, with maps, what we call parametric maps, but you can also quantify this. And we're going to come to this